thanks everyone for coming here and allowing me to speak about two of my favorite topics. The first being healthcare and healthcare research. The second being NBA basketball. And many of you are probably wondering, what do these two seemingly unrelated subjects have in common? How am I going to be able to bring them together and talk about them together with you today? Well, I'm a cardiologist and a health systems researcher, and I spend my life thinking about how we can make our healthcare system better, how we can make the experience for patients in our healthcare system better, how do we make outcomes for patients better, and how do we ensure that our healthcare system is sustainable for the future and for future generations of Canadians and people around the world. And I'm sure if you open up the paper today, either in Canada or in the United States or around the world, you hear the same thing about healthcare over and over again. That despite all of our medical advances, the truth of the matter is our healthcare system is under strain by an aging population, increasing burden of chronic diseases, and a system that doesn't seem to be giving us the quality and the value for our precious dollars spent, and increasingly becoming unaffordable. A lot of people have tried to tackle this problem in a couple of ways and have looked to other industries. These industries include the manufacturing sector. They've even looked at the airline industry and trying to use safety techniques to be able to think about how to make our system better. I, as also a massive basketball fan, have been intrigued by the massive transformation that we've seen using data in professional sports. And I've often thought that running a professional sports team is kind of similar to running a hospital, because what you're dealing with is really highly trained, highly skilled professionals who are all working towards a goal. So what I've done and what I'm going to talk a little bit about today is how we might be able to use some of the techniques and some of the tools that have been taken from professional sports, and particularly the data analytics that have transformed the National Basketball Association and teams that play in it, and how some of those techniques might be applied to healthcare. And let's see how it goes. So first, let's talk a little bit about basketball. Obviously, I'm not somebody who played in the National Basketball Association. However, I've watched the game a lot. And what's been really interesting is a transformation happened in the NBA about 10 years ago. And this happened with a partnership that the NBA used with a company called SportsView. It was an Israeli-based company that actually created cameras that can take a lot of data from player movement and ball movement. And in fact, about 10 years ago, they started to install these cameras in NBA arenas all across the America and in Toronto. And what they found was these cameras can take data faster than the eye can see, faster than what we can record, and created millions and millions of data points. What those data points now allowed data scientists to be able to do is understand patterns and being able to understand algorithms of what type of shot and player movement could actually optimize performance. And so with data analytics, they have been able to transform the way basketball is played in two ways that I think are related to healthcare. One is how they optimize player performance. How do you get players to play at their best? And the second is how do you use that data to make sure that teams are performing optimally? Well, healthcare is all about teams. So let's see how two of these examples might actually work in healthcare. So the first is, this is what we call a heat map. This is a heat map, which is where players take shots. And this is what SportsView can do. This is a heat map of LeBron James. For those of you who haven't heard of LeBron James, and I'm sure most of you have, he's arguably the best player in the NBA and one of the best players of all time. And I'll just preface this by saying that in the NBA, data has shown that there's really two types of shots that are valued over all others. One is shots closest to the basket, because the probability of them getting in is high. The second is so-called behind this line right here, the three-point line. And because even though the probability of hitting that shot is lower, you actually get 3 points instead of 2. You can see that in 2010, 2011, when LeBron James won the MVP, or the Most Valuable Player trophy, he actually took a lot of shots that a lot of people would say are inefficient. These are in the green area right below the three-point line, which are so-called long twos, which means that the shot has a lower efficiency, a lower probability of getting in, but you only get 2 points if it gets in. People say that LeBron James is one of the most aggressive and one of the best students of the game. And what you see from 2010 to 2016-17, which was just last year, is you can see that his game has changed and it's evolved. You can actually see that using data, he's actually taking more shots that are efficient behind the three-point line and continuing to take shots closer to the basket. And those so-called long twos, that green area right below the three-point line, has actually almost gone away. So LeBron James, even though he was a great player in 2010, 2011, is able to use data to get better. Now the question is, can we do this in healthcare? Can we do this with doctors? And so I'm going to show you 2 studies that we did. The first study is the graph on your left. And this graph shows the percentage of doctors in Ontario ordering unnecessary cardiac tests, unnecessary ECGs. These are tests that really don't have a ton of value and often can lead to either increased costs or worse or downstream testing for patients, which can be harmful. And what we see that in overall, about 20% of patients in Ontario get one of these unnecessary tests. And yet, what you see is a wide variation. So the y-axis in all those bars is the number of doctors ordering a certain percentage of tests in their patients. In total, there are about 7% of Ontarian physicians who order unnecessary tests on more than 50% of their patients, some ordering unnecessary tests on almost everybody. But here's the problem. Nobody actually knows where they sit on that curve. Nobody's getting their own stats. So then the question is how, if you don't have your own data, how can you be able to improve? And so the question that we answer in the next slide is, if you did get your own data, if you were able to show doctors their statistics, would they actually improve? So then we did a study, and this is the panel on the right, which actually was what we call a randomized trial. So we split 180 doctors into 2 groups. One group that got no information about their statistics, about their ordering practices, and another group that got monthly feedback on their ordering practices of unnecessary tests. And the gray line is actually the group in the intervention group. And the white line, or the white boxes, are people in the control group. And what we see almost immediately is that people or doctors that got their own statistics ordered far fewer, in fact 25% fewer, unnecessary cardiac tests on their patients than people who didn't know their own stats. Which sort of gives you evidence to say that doctors, like players, use their stats to improve. So if we just gave people their statistics, they might actually be able to make better decisions and improve their performance. And so, on the one hand, statistics can be used to actually improve player performance, in this case, healthcare provider performance. But what about team performance? Can we do something about that? Sure. So this is a heat map that shows 2 players. One is Steph Curry from the Golden State Warriors. The other is DeMar DeRozan, Toronto's own DeMar DeRozan. Both are all-stars. Both lead their teams. But 2 players play very differently. Steph Curry, where you see all those balls are where he takes shots, all those dots, he takes his shots mainly behind the three-point line and layups. DeMar DeRozan doesn't take as many three-pointers and actually takes most of his shots below the three-point line as well as layups. The truth is both are great players. Steph Curry's Golden State Warriors have won the NBA championship 2 of the past 3 years. But the thing is, if you substituted DeMar DeRozan for Steph Curry, they probably wouldn't win championships. And the reason is not because DeMar DeRozan's not a good player. The reason is because the team that Golden State plays on sets up its offense to maximize the skills that Steph Curry has, meaning it has a strategy. Toronto, on the other hand, has a completely different strategy that has to be based on the skills that a player like DeMar DeRozan has. Why does this matter? Why does this matter in healthcare? Well, it matters because oftentimes we don't think about individual physician, individual nurse, or individual hospital capability when we're designing strategies. We like to think that every hospital should function absolutely the same. And I'm going to show you in the next couple slides that that's not actually true. That in fact, hospitals operate differently based on the skills, capabilities, and structures of their individual institutions. And that variability is something that if you don't understand, you're never going to be able to solve healthcare problems. So this is a study that we did a couple years ago that shows that for patients with heart failure, a very common healthcare condition that often brings people to hospital. Hospitals in Ontario, Canada, have different rates of admission for the same patient. So in fact, you could go to one hospital and it may not admit you. You could go to another hospital and it's going to admit every patient that's exactly like you. So we were able to categorize 3 sets of institutions. Institutions that had low admission rates, institutions that had medium admission rates, and institutions that had high admission rates. And what we found was institutions with low admission rates, meaning people who did not admit patients with heart failure, had higher rates of poor outcomes, including death, readmission, or repeat emergency room visit within 30 days, which was bad for patients. And yet, if we actually look at the hospitals that were low admission rate hospitals, they all shared a few things in common. They were generally smaller hospitals with fewer beds, fewer ICU beds, and less resources. Now, you might say, well, that tends to make sense. But here's the interesting thing. Without thinking about it, these hospitals developed their own strategy for their team. Because they had lower number of beds, the admission threshold was raised. It was higher. But I bet you that none of those hospitals knew exactly what their stats were. They were like 5 guys playing pickup, basically saying, let's just go out and play basketball and see how we do. As opposed to actually saying, well, what do our stats say? And is there something that we can do with what we have? Smaller hospitals, in fact, do have advantages. They often have really tight linkages to primary care in their community. They often, everybody knows everybody, and they have tight social circles that they can potentially work to manage players. They could also partner with larger hospitals. So there's a lot of things that you can do to adapt your strategy. So just because you don't have LeBron James, you don't have all the money in the world, the truth of the matter is there are things you can do. But the only way that you're going to be able to identify a strategy is with data. Here's another more stark example that happened at a large hospital, teaching hospital in Toronto. So most of you know that emergency room admissions or emergency room wait times are a problem. Everybody complains about going to the emergency room. They always say that you have to wait too long. And they say that often it's because there's not enough doctors and not enough nurses to actually see all the people that are there. Well, that's sort of true. But I'm going to show you exactly what happens when you look at the data. So this graph shows the percentage of all of the patients go in a 24-hour period that get admitted from the emergency room into hospital. And what you see is between 8 and 4, about 16% of people get admitted. Most of the patients, in fact, the vast majority of patients, get admitted after 6 o'clock in the evening. Well, let me ask you guys a question. When are most people working at the hospital? Are they working from 8 to 4, or are they working from midnight to 8 in the morning? Yeah, so most people are actually at the hospital when most of the patients aren't there. So no matter what you do, the more money, if you put into a system like this, you're never going to solve the wait time problem because you're going to put money into times when the people aren't there. So unless you have data that can help you develop a strategy that's going to treat people when they're there, you're never going to be able to solve the problem. So this is where having data to be able to develop a team strategy is so important and so critical. So data has to be used by coaches, who could be hospital administration, division heads, to be able to develop team strategies that can actually help improve care for patients. So finally, the question is, and the question I get asked a lot is, well, Sacha, we don't have sports view. How are we actually going to be able to, get this data, to be able to analyze it, to be able to make some of these decisions? We don't have, that data capability, so where are we going to get it from? Well, the answer is you. The answer is all of you have a smartphone. Many of you might have a Fitbit or have an Apple Watch. And there's a lot of technology coming out nowadays that is going to be wearable, where you're going to be able to transmit blood sugar information, blood pressure information. You're already probably getting your steps and your heart rate taken if you wear a Fitbit or an iWatch. All that information is going to be amazing to be able to help you manage care for yourself or your loved ones with a chronic disease. But what it also can do is provide us with real-time data about how our patients are doing. Imagine if you left a visit with a doctor and you got a text on your smartphone that asked a survey question about how did we do today. And imagine that doctor or that team also got collated information from all of their patients about how they thought their experience was. Do you think that might change the way that you got care? Do you think that might change the way that a doctor acted if their stats weren't great? How about for a diabetic patient who transmits their blood sugar information into a clinic? On the one hand, one of the things that can happen is a diabetic doctor can see the blood sugars from all of their patients and actually see how good control their patient panel has compared to other doctors. But entire clinics can also see how they're doing in comparison to other clinics. And that can help you design strategies to begin to better manage the care of patients with diabetes. So the answer is patients and citizens with data that they're going to be able to collect from the myriad of different devices that they have the potential to be able to transform the way we deliver healthcare by providing data that's actually going to be able to help doctors or players and teams or hospitals and clinics be able to devise better strategies to really create a championship healthcare system for all of us. Thanks so much.